Here's a new option that could make managing your prescription drug costs easier: the Medicare Prescription Payment Plan. Now, I know that keeping track of medical bills and out-of-pocket costs can be stressful, especially when it comes to your medications. But the new plan is designed to take the worry off your shoulders. So, what is the Medicare Prescription Payment Plan? Simply put, it's a way to spread your out-of-pocket prescription drug costs over the entire plan year instead of paying big chunks all at once. This makes it more manageable for you to budget and keep up with your healthcare expenses. One of the most important things to remember is that your out-of-pocket prescription drug costs will be capped at $2,000. This means that no matter how many medications you need or how high the costs get, once you hit that $2,000 cap, you won't have to pay any more for the rest of the year. Here's how it works once you're enrolled. You'll be charged $0 at the counter when you go to the pharmacy. That's right, nothing out of pocket at that moment. Instead, your plan will take care of the upfront costs, and then you'll receive a bill from your plan later for any out-of-pocket expenses. It's important to know that your deductible still needs to be paid first, and copays may apply depending on your plan. And because this is a payment plan, your monthly bill might fluctuate based on how much you've spent on prescriptions that month. Some months might be lower, others a bit higher, but the idea is to ensure you're not hit with large, unexpected costs simultaneously. And here's something else I think you'll appreciate: you can opt out of the plan anytime. If you decide it's not working for you, no worries. You'll just need to pay off what's owed, and you can go back to your previous payment method. This plan aims to give you more control over your healthcare costs and make it easier to manage your budget throughout the year. How does the Medicare Prescription Payment Plan work? Especially when your drug costs vary throughout the year. This plan is designed to make your out-of-pocket costs more manageable by spreading them out over the year. Let's take a closer look at how it all adds up. Look at this chart with 6 columns. We've got the month your out-of-pocket costs incurred, how those costs are spread across the remaining months of the year, the split cost, the maximum monthly cap, and finally what you'd pay each month. Let's start with January. In this example, January shows no drug costs. But if you look at the max monthly cap column, you'll see $166.67. That's the most you could be charged per month if you had a $2,000 drug cost in January. Why? Because $2,000 divided by 12 months is $166.67. This is your monthly cap if all your drug costs are required upfront. Now let's move to February. Here the chart shows a drug cost of $1,200. Since it's February, there are 11 months left in the year. So we divide $1,200 by 11. That gives us $109 per month. If this were your only drug cost for the year, your monthly payment would be $109 monthly. But we're not done yet. Let's go to March. In March you have another small charge, just $12. We divide that $12 by 10 months, since 10 months are left in the year, which comes out to $1.20. We add that $1.20 to your $109 from February, so your new monthly bill is $110.29. Skipping down to August. In August, you see a larger drug cost of $530. Now, since there are 5 months left in the year, we divide $530 by 5. That gives us $106 per month. Add that to your July max cap, and your new monthly bill becomes $249.84. So what does all this mean? By the end of the year, your out-of-pocket costs are spread out in a way that helps you manage payments without getting hit with a huge bill all at once. The most you'll pay in total for your drugs over the year is $2,000, which is the cap. And remember, all your drug costs for the year must be paid by the end of that calendar year. Then everything resets and the process starts over. I hope this breakdown makes sense. If it doesn't, don't worry. We will go through it one-on-one.